Maria start the recording, as you can see. And just a reminder, you guys are not, we can't see you and you're all muted, but our panelists are able to unmute themselves. So welcome. We are so happy for you guys to be here today. This is Let's Grow Kids' first webinar called Making Sense of Business Resources for Childcare Programs. A ton of you registered. And we're so happy to be able to support you during this time. My name is Emily Blistein. I'm the Business Strategy Director at Let's Grow Kids. Normally, I'm working with business leaders across the state to highlight why childcare is so crucial for our economy. Today, I'm going to be giving an overview of this webinar. I'm going to be doing some housekeeping and introducing our presenters. I'm really happy to be with you personally. You guys are some of my favorite small businesses, and on a personal note, I am currently homeschooling a second grader, and I am sure that it is going as well as it is because of the really high quality early care he got during those first 5 years. So a heartfelt thanks from all of us to all of you. So this webinar is the first in a series that we hope to do for all of you. We really want to help you make sense of all of the available resources that are out there for you. We know you're juggling a ton. We know you have a ton of questions. And so what we've decided to do is convene some of our state experts in business, HR, finance, and legal services. And I'll introduce them in a moment. But we really wanted to convene these experts to be able to give you a good overview of a few subjects that we know you have a ton of questions about. Our goal is to be a resource for you. So we're gonna let each of our panelists have about 5 minutes to give an overview, and then about half of our time will be reserved for Q&A. We really want to be able to give you as much as we can so that you can make the best decisions for your businesses. I do want to note we can't make individual business decisions for you, but we know that you have so many questions that in addition to these webinars, we're also setting up some one-on-one consulting for you with these experts. So if you have questions after this webinar about something that's really personal to your business, we're going to be setting up a web page on our Let's Grow Kids /coronavirus webpage where you'll be able to put in your individual questions, and we'll link you with one of these experts at another time for some one-on-one care. Again, these webinars will be recorded. We'll be saving them on that Let's Grow Kids /coronavirus webpage under the Early Educators section. So you can go there to see this again, to share it with your peers. We'll also have a link to the PowerPoint that you're going to see here as we go along. Once you get that link, you'll actually be able to click through to those links that we're talking about. You can't do that today, but that will be available to you. You all registered with your email address, and that's the email that we'll be using to let you know about upcoming webinars for this as well. So just a side note, I think that you all know we're all working from home in various states of internet and with varying numbers of kids and dogs around us. So there's a bunch of us on this call. We're going to do our best to be as attentive as we can to you, but you may hear some noises in the background. And just a reminder, as Maria said, please use that Q&A function, not the chat function. The Q&A will keep your questions for us, so if we can't get to everyone's question, we'll be able to follow up with you individually to make sure your questions are answered. So with that, 1:05, right on time, I'd like to introduce our experts to you, and then I'll hand it over to them. So first, we have Angela Earle Gray and Alyssa Pelow, for their HR consultants from AdaptivaHR. They've been working with us for about 1.5 years now on some other business work that we've been doing, and we're thrilled to have them discussing the Families First Coronavirus Response Act with you. Then we'll have John Hollar and April Tuck, they're attorneys from Downs Rachlin Martin, and they'll be discussing unemployment insurance. Then from our team, we have Trey Martin, who's our general counsel, and he'll be discussing Vermont's Child Care Stabilization program. And then we'll have Lawrence Miller, a consultant from Five Vine Consulting, and he'll be sort of helping you wrap this up and helping you make sense of what this means for you and your business. So again, at that halfway mark, we're going to open it up to questions from you. And at that point, I'll turn it over to Brenda Metzler, who's on our programs team. Many of you may know her as being a community specialist who's working with programs on a lot of your improving quality and capacity work that you're doing in your communities. So Brenda's going to help moderate that Q&A section for us. thank you again for joining us today. Again, Let's Grow Kids /coronavirus. And honestly, if you just go to Let's Grow Kids, we've got a banner that'll link you right to that page for any follow-up. And thank you. We know this is a really overwhelming time for everybody, and the early care community has been stepping up in a huge way to support our youngest citizens and also our businesses who are serving essential workers right now. So thank you so much. And with that, I'll turn it over to Angela and Alyssa.
Hi, everybody. Thanks for being here. Thanks for the work you do. It's really important. Before I jump into the Families First Act, just thank you to Let's Grow Kids too. How quickly you pivoted to be focused on what's most relevant right now is very impressive. The Families First Coronavirus Response Act actually became effective yesterday. So as of yesterday, there are some additional types of leave that you should be offering to your employees who are working. If you let go of people before yesterday, they weren't your employees, you don't have to think about doing anything retroactively. If somebody took time off in March, it doesn't have to be reallocated or looked at again. But this does stay in effect until December 1st of 2020. So there is a possibility we're going to go through some ebbs of flows in terms of what can and can't be open and what's going on, how much we're seeing the virus in our area. But if somebody is an outlier and has things come up that are related to this act later in the year, they will still be eligible for the leave. There are 3 types of leave under this act. Our slide primarily is talking about the first 2. All employees are eligible for those first 2 types of leave. There is an extended leave portion, which would be available for your employees who you've had on board for over 30 days. And this applies to all public businesses that have 500 employees or less. So most businesses in Vermont, right? And again, there's 2 types of leave under this, or 3 types. The first 2 are for when an employee is sick, or when they're taking care of a family member who's sick, or a child who doesn't have childcare available because of things related to the coronavirus. And for those 2 reasons, you're going to initially get up to 80 hours of paid sick leave. That's and what the hours actually are, it's based on weeks. So it's 2 weeks of your time. If you have somebody full-time, it's 80 hours. If you have somebody part-time, it's whatever 2 weeks are for them. And then I'm going to let Alyssa jump in and tell you a little bit more, and she'll move to the other side of the slide.
Thank you, Angela. My name is Alyssa with AdaptivaHR, and I wanted to go over qualifying reasons for taking this leave that's now in act from yesterday. So what you need to go by is we have employees that are subject to federal, state, and local quarantine or isolation order related to COVID. An employee that's experiencing symptoms of COVID and seeking a medical diagnosis, employees that are caring for an individual who's required to quarantine or self-isolate, and an employee who must care for their child if the school or place of care of their child has been closed due to COVID, which has been happening, as we know, a lot more recently. And something to note too, with all of those cases, you'll want to make sure with your employees, since there are those various scenarios, that you do have them provide you in writing with their qualifying reason for taking the leave. And then the other element that we want to go over is, what are employees paid during this time exactly? So paid sick leave must be paid at the employee's regular rate of pay. You'll want to make a note of that, or minimum wage. So it would be, you would defer to whatever is greater. And then an employee taking leave for a family member is compensated at 2/3 of their regular rate of pay, or minimum wage, whatever is greater at the time as well. And then another, Oh, I'm sorry. Did someone say something?
Go ahead. No, keep going.
Okay.
That was on me, but I didn't thought you were done.
Okay. I just wanted to make a note of one more thing. If the employee has other paid leave available, which has come up, an employer may not require an employee to use other types of paid leave provided by the employer before the employee uses the paid sick time available under this law. And that's it.
Okay. And the piece I was just going to say is, again, this is something that should have been in effect as of yesterday. If you didn't have it in effect as of yesterday, that's okay. But there is a mandatory poster that the Department of Labor has put out that you are going to want to get and communicate to your employees and let them know that it was in effect as of yesterday. The other thing you're going to want to do is make sure with your payroll company, you're setting up appropriate pay codes to track what type of leave they're using. Are they using leave for themselves at 100% pay? Are they using leave for a family member or childcare at 80% pay for that first 2-week period? Or have they moved into the extended leave, which provides an additional 10 weeks of pay at 2/3? And that is specifically for taking care of children because you don't have another childcare option based on their childcare closing due to the virus or losing their childcare and some reason for that. If you are tracking those 3 leaves, the government has indicated that they are going to do some tax credits. They're going to do something to help support businesses providing this. I don't have a lot of details on how that's going to play out, but for your own records and for being able to be sure that you can show your compliance, you really do want to make sure that you're tracking that accurately in your payroll. I think that's what we have for you, Emily.
Great. So now I'm going to turn it over to April Tuck and John Hollar from Downs Rachlin Martin.
Thank you, Emily, and good afternoon, everyone. Thank you for being here. Thank you for Let's Grow Kids for putting this webinar together. So I'm going to give you a quick overview of changes in state and federal laws as they relate to unemployment insurance. I'm going to be pretty brief because I think many of you are going to be familiar with these changes, and I want to leave plenty of time for questions that you might have. So let me first talk about state law, and you're going to get a document later that summarizes these, so don't feel like you have to write down what I'm saying here. But let me give you a quick overview of what the governor signed into law on Monday. The legislature essentially created 5 new categories of unemployment insurance claims that relate to the COVID virus and crisis. So the first is a new eligibility for individuals who are required or recommended to self-isolate or quarantine as a result of a recommendation or order from a healthcare provider, the governor, the president, or public health authority. If somebody has been diagnosed with COVID-19, they have symptoms or have been exposed, or if they belong to a high-risk group. Now that last category is one that's changing. So we saw just this week the governor designate as a high-risk group anyone who's coming into Vermont and is required to quarantine for 14 days. So those individuals would now be eligible for unemployment insurance. Second general category is individuals who become unemployed because there's an unreasonable risk of being infected with COVID-19 at work. Now, that unreasonable risk is defined as a workplace where the employer is not in compliance with directives issued by the CDC, the Department of Health, or OSHA for minimizing risks in the workplace. The third category is the need to care for a family member who is self-isolating or quarantined, again, at the recommendation of or directive of a provider, public health authority, the governor, or the president, because that individual has COVID-19, has symptoms, or they've been exposed, or again, belongs to a high-risk group. Now, the fourth general category, new category, is a broad one, and I think it's going to create some challenges in terms of verifying the legitimacy of claims, and that is the eligibility for individuals who depart from work due to a need to care for or assist a family member who leaves employment because that family member feels that they're facing an unreasonable risk of being infected, again, because they allege that the workplace is not compliant with CDC, OSHA, Department of Health orders or directives. That's going to create some challenges for the state. Typically, employers are in the position of challenging claims because they are subject to increased experience rating charges as a result of these claims. None of these new categories will result in higher experience rating charges to the employer. So employers will no longer have an incentive to challenge any claims that they might believe are not legitimate. And in this case, you have one step removed, where it's really the family member's employer that's being alleged not to have been compliant with health orders or directives. And then finally, the last new category created by state law for eligibility for unemployment insurance is any individual who is caring for a child because the child's school or child care is closed. So of course that means anyone who has a child ages up to age of essentially 18, 17 or 18 in public schools is now eligible for unemployment insurance. There are some additional categories. So as I mentioned, an unemployment claim filed in any of these categories will not result in an experience rating charge to the employer for the duration of that claim. There's another set of categories that for which the claim, the experience rating charge is limited to 8 weeks. I'm not going to go through those. I think you'll get that information, follow-up memo, and we can provide you with more information on this if it's necessary. So next, I want to go real quickly to changes in federal law. And I believe you have a slide here that describes these changes. The second bullet outlines the one that I think everyone is familiar with, and that is the new federal unemployment benefit of $600 per week that will be available for the next 4 months. That will be added to state unemployment insurance claims, and then the state will be reimbursed by the federal government for that amount. And the intent of this by Congress was to encourage non-essential workers to stay home. So there was a general understanding, going to the third bullet here, that some individuals, many who receive incomes of under $58,000 or so a year, are going to receive more in unemployment than they received in their paycheck. And that was intended by Congress to ensure that individuals stay home. The interplay with Vermont law, which relaxes the ability for individuals to file unemployment claims, I think is going to create some challenges. And we can talk about that a little more, but I would mention that this is an issue that the state legislature is very aware of, and I think are looking at responses, and we can talk more about what some of those options are. But clearly an issue that I think the state is going to be grappling with as individuals leave the workplace and seek unemployment, creating some shortages in some workforces. The law expands coverage to include self-employed and independent contractors, individuals who in the past have not been eligible for unemployment compensation. It adds an additional 13 weeks of benefits in addition to the 26 that are typically available. So for a total of 39 weeks of benefits. Federal law waives the normal 1-week waiting period and includes funding to offset half of the costs that are going to be incurred by state and local governments and nonprofits to pay for additional unemployment for their workers. Funding for this law expires December 31st of this year. I think that concludes my 5 minutes. So I will pass it on to Trey and then be available for questions afterwards.
And I just want to note quickly before Trey goes, we do see your questions coming in, and Brenda's already categorizing them for the right folks to answer during the Q&A. But just to let you know, we've got about 100 people on here, so there's a bunch coming in, and we do see them. Go ahead, Trey.
All right. We're going to go to the next slide here. At the outset, I want to say that this is as I talk about the Child Care Stabilization Program that CDD announced over the last couple of weeks, I am going to give a broad brushstrokes overview. We really want you to understand the basic parameters of this program, and we want you to understand it in the context of the other new programs and options that are available to you. I think for some of you, it's going to be review of things that you already know a little bit about, and you'll also see that through the slides there's some redundancy, because what I really want to do today is underscore the key concepts. And then if you have individualized questions, you can raise them on the call today, or you can raise them with us afterwards through the web form or by contacting Let's Grow Kids. I would also say that everything I'm talking about today is is in reference to the guidance and the frequently asked questions that CDD promulgated last week. So, you know, they are really the experts on this topic. There's a program they developed in response to the crisis. And I know that they're planning to launch another FAQ either later today or tomorrow, which gets into more detail, especially for the time period after April 6th. And then in conjunction with Building Bright Futures, the division is going to be doing a webinar next week to focus on the stabilization program. So, you know, you look out, we'll publicize those of the day and time, and I'm sure they will as well. The key point of this program, and I'll keep coming back to it in this brief presentation, is that we want to keep childcare businesses whole during the crisis, or that's the goal of this. And so there's continued payments of CCFAP and Act 166 dollars. This program is predicated on asking parents to pay something. There was an initial period, we'll talk about that, and then the sort of ongoing period and what parents had to do during those two different time periods is a little different. And then the state is going to make up the difference of what parents can't pay, or after April 6th, you know, pay 50% to 100% of those parent payments. So it is, you know, we think it's a really terrific option. How it stacks up for you all in your businesses compared to unemployment insurance or the other federal programs is something that is, you know, we're very interested in, and we're interested in your questions. You'll see Katie Lally's contact information there. She's the CDD contact for questions. And of course, you know, you can contact our programs team member at Let's Grow Kids or navigate to our resource page. Next slide. So the, you know, again, the most important point of this slide is just to note that the program rolled out in 2 phases. So there's that initial closure period that started on March 18th and goes till April 5th. And then the extended period that goes from April 6th until the closure order is rescinded by the governor. During those 2 different periods, you know, first in the initial period, the instructions from CDD was that you were to ask the parents to continue to pay 100% of their tuition or copay, but to invoice CDD through the mechanism that they set up where parents were unable or unwilling to pay. And that CDD would then, you know, make up that difference. After April 6th, that shifts. And so this is it's really important to know that the way that you're going to invoice and the way that you're going to interact with parents and CDD is going to change, because after April 6th, you'll be asked to change that request of parents to ask them if they'll pay 50% of their tuition or their copay, and CDD will pay the other 50%. We know there may be parents who can't do that or won't be able to. And the way the CDD is handling that is saying that you can unenroll those folks, unenroll their kiddos. And at that point, once you certified that to CDD, they would pay 100% of that tuition. Next slide. This is a busy slide, and I won't try to read it all to you, but it's really, you can visit this later, and again, you can contact us or CDD with questions, but really kind of lining out the differences between the 2 phases. You know, the differences between the initial page and the initial phase and the extended closure page are pretty small. It's really around what parents are being asked to pay. The consistency is that, you know, this program asks you to continue to pay staff to comply with CDD guidance for invoicing, for exchange of information, and so that doesn't change from week to week. But the ask of parents does change, and the you know, the way that this works for kids of parents who can't pay is obviously different after April 6th, because you would have to unenroll them. Last slide. So just a couple, again, final details to underscore is that, you know, for right now and until April 6th, you are requesting that full payment, and you were instructed to keep slots for children who whether they pay or not, and to pay salary, full salary to staff throughout the period, which includes, you know, owners and childcare homes. And then after April 6th, again, it's that 50% payment request and the unenrollment for those who can't. Just to sort of wrap this up, I want a couple quick reminders and then a final note about why the state's doing this. So the reminders is that we will, as soon as we see the FAQs, we will develop, a page on that and send that out, folks. I'm sure you'll get that from CDD as well. And I know they're working really hard on that. So if you've sent questions to Katie, it may be that they're waiting to get the new FAQs out before they answer questions. So for today, once you ask us your questions, but then after those new FAQs come out, you may have additional questions which you can let us know. We may have already figured out how to answer them and can help you, or we're letting CDD know the kinds of questions that come in. The other thing I want to say, just sort of in closing about this, is that this is not your only option. You heard about some other options, and in future programs, we might talk about some of the other the loan programs that are available out there. There's the economic injury disaster loan and grants. There's the paycheck protection program, some additional kind of payroll tax options that you might have to protect yourself. You're not required to participate in the Child Care Stabilization Program, but it is intended as a way to keep your program whole, to keep your staff paid, and to be ready to turn the program back on at the end of this closure period so that Vermont can get back to work. And this is coming at a fairly good cost to the state. It's $1 million to $1.3 million, $1.5 million per week, depending on how many people take advantage of it. But the state has made a commitment to it because they recognize how vital you all are to our economic picture, to the recovery, and to the ongoing work. So as you're thinking about your options, that if I know this one is complicated and it's not without its challenges, but certainly the state's going to try and figure those out, and they really want it to work for those reasons that I just said. So thanks very much. We'll turn it over to Lawrence Miller now and let him sort of kind of deliver the punchline, or what does it all mean for you? So thanks, folks.
Thanks, Trey. I'm coming at this from the perspective of somebody who spent a bunch of years in state government, a lot of it with Trey, in disasters. So I don't have any inside lines, but I'm speaking from an understanding of what's going on, and we might as well just jump into the next slide. There's some questions that I saw about how long this might go on. What's the chance? There's virtually no chance that the April 15th date is relevant for anything but an expect further guidance date. We're going to be in this for a long time, and the goal for the state is really avoiding thousands of deaths and keeping it to hundreds, and that's the leading priority. Throughout this period, I'm writing a daily newsletter on major developments, both in health and in business related. This will get circulated after the webinar, so you can subscribe to that if you find it useful. I think the other great place to start is the Agency of Commerce website. They've got links to all of the other ones. They've got good discussions of many of these programs. I think it's important to note, though, that a lot of these programs are being launched now in ways they've never been available before. And so, and some of them are launching before the official federal guidance comes down. So a lot of this is conjecture, and based on the statute, necessarily not yet on the regulation. And that's particularly true for some of the SBA options that you'll see. But you've also got very good facts at labor, tax, and the Agency of Human Services and the Department of Health. And you can link to all of those from Commerce. Federally, CDC and IRS are both putting out a lot of stuff. CDC in particular, if you're trying to figure out what standards you need to meet for cleaning, and IRS is saying, just don't send us any money for now. It'll all be fine. And so I think as you think about how to manage cash flow, taking care of deferring what taxes you can while putting that money aside in a savings account instead of your operating account, if you can, is a good tactic. And keep coming back to the decisions that you've made and reassess whether the guidance for those decisions has changed at each point. We'll go on to the next slide. So big deal. Taking care of yourself and your colleagues, especially in the long run. If you don't have health insurance, haven't been able to afford it before, or it hasn't made sense to you before, and now you're changing your mind, there is a special enrollment period that's open right now. In Health Connect, you can apply both for commercial insurance with subsidies, and it will also evaluate whether or not you're Medicaid eligible. I know many of you have other household income impacts going on at the same time. Your partner or spouse may be having work challenges, lose employment, those sorts of things. We can help with this a little bit, but the simplest thing is just go right to Health Connect and reapply there. Learn the symptoms. Don't go anywhere. Don't go try and get a test. You have to call your doctor. They'll make a decision as to whether or not you have mild or moderate symptoms. They'll make the decision about whether or not they want you to go in for testing and make the referral. Mental health is huge. A lot of your families are going to be facing challenges, as well as you and your employees. AHS has a great resource and tools on their page for managing stress and building resilience on their COVID-19 page. We're not just talking about anxiety, depression. There's a lot of grief management that goes into this. And obviously, we've all got tremendous concerns about stresses at home turning into child abuse situations, substance use disorder changes, and everything else. My error on the March 20, the special enrollment period opened March 20, closes April 17th. Sorry about that. This idea of a risk log and an opportunity log, this is a tool that I suggest for people. Write down everything that's worrying you, put it on a page, score it as to likelihood and consequence. Low likelihood, low consequence, you accept the risk. High likelihood, high consequence, you avoid it. Everything else, you mitigate it. It's really important to get those worries out of your brain and onto paper. They don't do any good in your brain. And I'm suggesting you do the same thing for an opportunity log. This is a chance to reimagine what you want your business to look like, what you want your life to look like. Take advantage of this time to do some thinking about that for yourself in the future. We can go on to the next slide. I had intended to cover a couple of the other programmatic questions that have come up consistently in about some of the other programs. So you've got the stabilization program available. There's also a $10,000 emergency grant available for all businesses. This is part of the disaster impact loan program, but the first $10,000 is just a grant. There's no way they can recapture it. So even if you're not eligible for an emergency disaster loan, where you don't want to take one because of personal guarantee requirements, you don't have to, but I urge you to go pull down that $10,000. And then you've got a choice between the PPP, which is a part of the CARES Act, which can provide 2.5 months of payroll, and that can be forgivable, or take advantage of a refundable tax credit, and it's refundable through the payroll tax system. And so I urge you to take a look at those things and do the math. It might not make sense for you to apply to the PPP if you can just take the tax credit, since you've got the revenue and are paying people. And now I'll turn it over to back to Emily for organizing the Q&A.
Thank you all so much. So that was a lot of information. I just want to remind you that this slide deck with the hyperlinks that you can click through will be available on the Let's for Kids website very soon after this recording, and the recording will be available within 24 hours. So we have already almost 50 questions. Brenda is managing them and trying to get them into categories. So I'm going to turn it over to her to start asking your questions of the panelists. Thank you.
Hi, everyone. Nice to see you here. I'm really glad you could make it today. There are, as Emily said, many questions, and they didn't come in an organized by speaker way. So there will probably be batting them around a bit. Some of them have already been answered after you submitted them. So I'm going to put the first couple of questions to you, John. And here they are. Any tips for keeping staff on the payroll if they'll bring in more income while not working is one that is up there a couple of times.
Sure. That's going to be a real issue, I know, for this industry as well as many others. I did mention that the legislature is looking at this, and I think we're going to know more in a few days about what the options are. Lawrence mentioned the Payroll Protection Act. I think there's a possibility that if you apply to that program, you could use that federal money. It's initially a loan, forgivable loan, so ultimately a grant to be used to increase your salary for your employees. So that's one option, and I'm not saying that's one you should necessarily be available, but I think it's one we're exploring. That's one option. The other is that the legislature may create a new category of a program category for bonus pay for individuals who are working in high-risk categories like child care. And I'd expect to know more about that within a few days as well. So unfortunately, right now, we don't really know what the right answer is going to be, but I think what you're going to find is that there's going to be additional money available to pay employees more to create a differential so that there's some incentive for them to stay at work.
Okay, thank you. And I have a couple of questions also for Angela and Alyssa. Let's see. Does Family First pertain to self-employed people, for example, registered childcare home owners?
So Families First is leave that you need to give to your employees. So if you don't have any employees other than you, you're still working with your budget and your owner draw from it. There's nothing that's saying you have to do anything for yourself related to it.
Okay, and then, thank you. Do programs need to be open for business to offer Family First? What happens if they're closed and all employees are essentially on leave?
If you've laid off or furloughed your employees, they're not actively your employees. So you don't need to be paying them if something happens during the time that they're laid off, but you do need to think about having the policy in place when you start to do recalls, since it's going to be effective for the full year.
And I'll also point out that the Department of Labor is waiving available to work requirements under these kinds of conditions. So your employee would continue to receive unemployment through that period if they're enrolled.
And another question around unemployment. For the unemployment insurance, I understand we need to pay into the unemployment at a certain rate. Will that rate increase if we decide to close, ultimately laying off our staff and they subsequently draw on the unemployment?
No, so both the Congress and the legislature have waived experience rating provisions. So if an employee accepts unemployment in any of the 5 categories I mentioned, and again, I think you're going to receive a follow-up memo that explicitly outlines those, you won't be charged for those costs for the duration of that person's absence from work as a result of those COVID-related exposure, essentially. If the employer closes, under state law, that experience rating charge is waived for 8 weeks.
Okay. Oh, I just wanted to address a couple of the questions I believe it may have already been mentioned, but the question was asked, can the slides be sent to us? Yes, all of the slides will be sent. We will do follow-up for any questions that we don't get to live. And well, there will be a lot of links. All of the documents that we referenced will be linked.
We just have a couple questions. Maybe Lawrence can answer this quickly while you're organizing, Brenda, about the $10,000 grant. Is it separate from the emergency loan, and where do folks get follow-up information about that $10,000 grant?
Yes, you're essentially applying for the emergency or the economic injury disaster loan, I think is the title of the program, and you can access it with an online application, and that's available at the Agency of Commerce's website, accd.vermont.gov, along with a little more explanation. As you go through the application, there's a place to just check that you would like the advance, and it's characterized as a loan advance, but it's been made very clear that it is simply a grant, and you don't have to apply for other additional funding through the EIDL. You just limit your application to that $10,000. Brenda?
Okay, so another question about unemployment. Are childcare providers eligible for unemployment?
Yes, that's one of the categorical changes that Congress made under, typically in the past, if you haven't paid into unemployment, you're not eligible for it. Congress changed those rules so that self-employed individuals as well as independent contractors will be eligible. The state is still trying to determine what the compensation rate will be, so we don't have those final determinations yet, but that eligibility will be there.
And if someone could, maybe more than one of you could address this, but there are several questions related to participating in the state stabilization program and unemployment, and is there any space for the two to overlap?
Well, I'll start that, Brenda, and then Lawrence or John or Angela, Alyssa may want to add in, but that question reflects one of the choices that you need to make with your business going forward. So the first thing to note is that both in the initial closure period and the extended closure period, a requirement to participate in the stabilization grant program is that you continue to keep your employees employed, i.e. you're going to continue their benefits and their full salary. So they are necessarily, under that scenario, not going to be laid off or furloughed or having reduced hours or reduced paychecks. If you have already laid people off or furloughed them, you can reinstate them to participate in the the stabilization program. You could do that retroactively with a retroactive return to service date, or you could do that as of the beginning of the extended closure period on April 6th in order to participate in that next phase of it. Or you could keep them furloughed, with a return to service date out into the future, and then they could avail themselves of the unemployment insurance program that's out there. But they wouldn't be able to do both of those at the same time.
So another one, during the extended closure period, which you just touched on, during the extended closure period, are parents who are currently receiving essential persons care also getting half of their tuition rate paid for by the state, or are they expected to pay the entire tuition? Will the hazard pay for these employees caring for the children kick in if the state is paying half of the child's tuition?
Brenda, if you want to jump in with this with me, please do so. I didn't write the answer to that down. My recollection is that if people are receiving, childcare because they're an essential worker, so they're actually using it, they're going to continue to pay their full tuition or their full copay. And so that 50% allowance is not there for those folks.
That's my understanding as well.
Yeah, I think again for all of you out there, please know that at least in our conversations with folks at CDD and maybe in some of yours, that they're trying to answer some of these more difficult questions in the next round of FAQs. And this piece around what parents are able to and expected to do is something that's, that's going to be at the top of the list of things that they want to try and address. Because we know that's causing a lot of consternation and heartburn for folks and who are trying to understand what they should do.
In addition to that, I would add that at Let's Grow Kids, where we are gathering all of your questions every day through every forum in which we interface. So when you have questions that you feel like you have tried to get the answers to and you just still aren't quite sure, you're welcome to funnel them to us, and we will have those. We have conversations every day with the Child Development Division, and we're happy to gather them and take them and then help to spread the answers back to you. I can attest to the fact that the licensors and the all the folks at the CDD's lines are very busy all the time, and that they aren't able to answer every call immediately when it comes in, but they are working very hard to amass the answers to your questions and get them out.
Brenda, there were a couple questions about whether or not programs have to charge that 50%. One asked if they could only charge 25%, and another asked if they could waive the family's 50% portion. Can you speak to that?
So the guidance that we have now is that you ask them to pay 50%. Those are the conditions of the stabilization grant as it stands. And we're expecting really any moment, perhaps more clarity around and more guidance around that from the CDD. Obviously, not every family is going to be able to pay that. And my best advice at this point is to document everything. So keep the most excellent records you've ever kept. And when families tell you, I really can't pay 50%, you don't want to have to be in the position of policing that, but you document it. You ask them to pay the 50%, and they'll do what they can.
And I think what the division is going to try to do is address some of the nuances of that question. Like, what if we have a scholarship program that pays for some of the tuition? Is that a way to pay the parents 50%, or is there some other way we can provide for that in our system? And so, like Brenda said, we don't have all the answers today. We expect the next round to come out from the division later. But I would say a couple quick notes though is that if somebody's income has changed, because of the crisis, because they've been laid off in a different industry, they may become eligible for CCFAP now in a way that they weren't. And so what was a tuition payment would be then a copay that might be more affordable. Another thing to note is that even if somebody's laid off and they're in a dire situation, the unemployment benefit that John and others have described so far does provide, the federal portion is of $600 a week is equivalent to about $32,000 a year. And that's on top of 50% of wages or whatever the state benefit would have been for folks. So we do think, and I think that the division's decision to ask providers to continue asking parents to pay some is based on the idea that there is going to be money flowing and that some people will be able to avail themselves of that so that parents can continue to hold those spots. You can continue to be in relation to them, and you can continue to behave like, at least from a cash flow and business perspective, like an entity that's ready to go right back to work, as opposed to having, discontinued, your operations, laid people off, and having a lag time after this crisis ends and the closure order is rescinded before you can get back into operation. So know that, those are sort of the intentions behind that.
There are some questions related to payroll and folks wanting to understand best practices for payroll through the unemployment of some of their staff. And does anyone want to speak to guidance around payroll and taxes?
Well, if I've seen a couple of these questions, and let me cover a couple of different aspects. The question of the payroll taxes, if you are paying people through this period of time, you can get a refundable payroll tax credit for half of the wages if they're working, and if they're furloughed and you're paying, and you have fewer than 100 employees, then all of those employee wages are eligible up to $10,000. And so you would simply, when you file payroll taxes at the next period, whatever your filing rate is, if you are owed money because you paid more wages than you owe in payroll taxes, that'll come back into your bank account instead of going out. So that's one mechanism. The delay of payment of employer payroll taxes is that if you're just unable to make those trust taxes, you can defer them through the end of 2020, with those amounts due once at the end of 2021 and again at the end of 2022. I'm not a big fan of that provision because it's really hard to come up with those amounts out in the future. And so I always like to keep up with trust taxes if at all possible, but if you're right on the edge, that is one mechanism. And then finally, there were a series of questions about the intersection between the stabilization program and other wages you might be paying and people being able to go on unemployment. If you're paying them, they don't have a wage loss for unemployment to replace. So it's my understanding that, you know, they would still be in that position of, even if they had opened an initial claim, if you bring them on and start paying them, when they file their weekly statement with the Department of Labor, they'll indicate what wages they receive, and the calculator, the computer will automatically recalculate what their unemployment benefit would be and drop it down. John, do you have anything to add?
No, I don't think so. I think you covered it. Thank you, Lawrence.
And there were a couple questions about if parents can't pay, do programs have to unenroll them? Is that?
So, and Trey could speak to this probably as well. If parents can't pay, you unenroll them. And then what I was just going to, the questions I was looking for, Emily, are linked to that, I think. So folks are, I hear a number of questions in the field and listed here where folks are concerned that if they unenroll a family, you know, what would it mean to re-enroll them? You can reinstate them the minute that you can reopen. And you know that how you roll that out is up to you. And I think that that's the kind of communication that is also stressing some families. So it's really important for them to hear from you. You know, this is so that I can participate in this stabilization program, which means that I'm going to be here when the minute that we can open again for you, and you're going to be welcomed back.
Yeah, Brenda, the only thing I'll add to that is that I think this is another place where the upcoming FAQ is going to try and be more pointed. So this, you know, I think that the division will want to make sure that that's it, you know, that the unenrollment is a real thing and that it's not a kind of wink to folks and somehow to try and get around the rule. The expectation is that that people will try to pay 50%, or that there might be a scholarship or some other way to do that, and they'll let us know where the flexibility is. But if they're unenrolled, do they go to the top of your wait list, or do they go to the bottom of your wait list if you have one? And you know, I expect that will be sort of more fleshed out as we go forward. If somebody's unenrolled, what would happen to their CCFAP? If they were a CCFAP, you know, if they were a copay under CCFAP, would you continue to receive that? Would they, you know, would that benefit still be there? Again, I think we'll find out more information about some of those more nuanced questions over the next day or so. And by the way, Emily noted at the outset, not only are we going to try and put together, you know, put some memos out to you all with these different topics, answer questions we didn't get to today, but we're going to try and do this on a weekly or bi-weekly basis going forward. So we'll come back to some of these topics. And if you continue to join us, you can ask questions so you don't feel like you've been answered yet. So after the next round of FAQs, it might be that we want to address some of the changes with y'all next week or the week after that. Finally, remember that that parent expectation is different this week and last week than it will be next week. So the initial guidance for the period through the 6th was ask parents to pay 100%, but if they're unable or unwilling, then you let the state know, whether that's unable, unwilling to pay all of it or unwilling to pay some of it. And the idea was that you'll be reimbursed. The 50% requirement is the going forward expectation as of April 6th.
There are quite a few questions also about sort of knowing when the end is, and I can't remember which panelist said it earlier, but we don't know. And at this point, we can't know. And I believe the guidance at this point, I know the guidance at this point is that until we are notified by the governor that we can carry on.
So I do want to recognize we do still have questions. A lot of our job right now is going to be devoted to categorizing these questions and getting answers to you in the clearest way possible. So again, I want to direct you to the Let's Grow Kids coronavirus page. We will be linking to everything that you've seen today. So anytime you see those blue hyperlinks, you're going to be able to access that through our webpage and be able to click through and get a lot of your questions answered. But also look for a new web form that we will have coming soon where we can help match you with the panelists that you've met today to answer some of your more specific questions. I want to thank you all again. This is being recorded, so you can watch it again. There's a lot of information here. And we just want to, again, send our heartfelt thanks to all of you. We know that some of you are closed right now. Some of you have reopened to help serve essential persons right now, which is incredibly important work. We're also doing some work around getting support to those programs who are open right now. So please continue to use us as a resource. And thank you so much. As Trey said, we're going to be doing these webinars potentially weekly. So that communication will be coming to you as well. Thank you, and we will be in touch soon.